So yesterday alone, over 3,300 new COVID-19 cases identified nationally, 43 more deaths reported across the country. With the festive season almost upon us and the Belito Rage Festival already adding to an uptick in cases, projections around a second wave are very worrying. What will a reckless December of partying do to our infections and deaths from COVID-19. I'm joined now by Professor Alex Van Den Heever, a specialist in health economics and finance at the Wits School of Governance. Prof, good evening. I'd like a comment from you, first of all, to Premier Alan Windey's plan. Do you think he's on the right track, that we just need more enforcement, tougher fines, but not more restrictions?
Yeah, I think he's correct. We've had a big problem with enforcement, and I think, but a large part of managing this epidemic depends on individual behaviour. That it's difficult to get, authorities, to engage with sort of poor behaviour. So that is one part. I think that it might be that there is a need for some limited restrictions, but not the ones that we had in April. To focus that are very targeted on the sort of super spreading events, because people are behaving badly at this point. And I think that enormous complacency set in. And I think what's happened is that we've had a large number of consecutive super spreading events which are contributing toward this upsurge, and it's now going to run through. So it can't just stop. It's like a fire, and it's got to die down. So I do agree with Alan Windey that we've got to be cautious about what we do, but we have to be very focused and make sure we stop this behaviour.
I mean, we've seen that the rage festivals have been cancelled. We've also seen that a lot of public facilities are closing. But the reality is, when there's alcohol involved, inhibitions just fall away. So if we carry on like we are doing at the moment, what is your sense of where the numbers are going to go after the festive season? What are we going to be looking at in early January?
It's kind of difficult to tell. One of the things is modelling has not been particularly useful in this epidemic. It kind of seems useful when you're looking at sort of general trajectories. But what we're seeing here are very specific takeoff rates. We're starting to see upticks in KwaZulu-Natal, in the Durban area. We're seeing in the Eastern Cape, we're seeing that the uptick is becoming more generalised, which is worrying. We see nothing in Joburg yet, although I'm aware of a significant number of instances where people have been infected in public places. And I think that we're going to see a little bit of that happening. So I think this is largely behavioural, and we have to change the behaviour. And we also have to understand that it is ventilation that is a real problem. People are becoming complacent about sitting in closed settings without masks on, and that is the big risk. So I think that we could be seeing a serious outbreak, but summer should be the time when we should be managing this risk much better than in winter.
Yeah, so you're right about the ventilation issue, and that could lead a lot of people to feel that they're completely safe on a beach. And, the wind is blowing, the sun is shining. We know the virus dies quite quickly in sunlight. But if there's heaps of people on a beach and you're all sitting really closely together, it still could create a super spreader, am I right?
Well, it might. So I would expect a beach to be lower risk. I think that what tends to happen now when we see this upsurge is that the probability that the person sitting next to you has COVID has increased significantly. So if it were, say, 3 weeks ago or 4 weeks ago, the probability would be lower if the prevalence of COVID was lower. So I think when we start to combine prevalence with proximity, then we start to see an increasing risk. I would say it's still less likely at a beach, but a lot more likely at a nightclub and a pub. And I think that there are people who have deliberately acted in a reckless manner during this period, and I think that then has a knock-on effect, because then a lot of people who are trying to be safe are suddenly unsafe because their family members are coming home from those events and infecting them, and that becomes an effect.
Yeah, we're also hearing some reports that the children that came back from the Rage Festival in Belito came back to Joburg, and some of them tested because they knew they should have, and they have it, but they're asymptomatic. Just how dangerous is the asymptomatic spread? Is it easy to get COVID? Is it just as easy to catch COVID-19 from someone who's asymptomatic than it is from someone who's showing symptoms?
Yeah, so there's an indication that during that sort of initial infection period, the infectiousness of the individual is very high. So in fact, that is a very high-risk period. So in a lot of other diseases, the sort of symptoms go together with your infectiousness. But in this one, it's deceptive because it looks like you're with a healthy person. And in fact, they're more infectious than they will be in a few days.
Well, that is certainly very...
So during that period, it's high risk, and people are... Sorry. And then people are a lot less wary because there aren't symptoms. But it is the asymptomatic period, that initial window period, that is in fact very dangerous for transmission.
And very quickly, are you seeing any indications that we are going to change behaviour? Because we've seen so many impassioned pleas from our president and others. Nothing seems to change that much.
I think that we have to be very targeted on who's doing this and where the events are, because I think that it does come down to the specific event organisers and the people who control those events, the shebeens, pubs, restaurants that are in enclosed settings, etc., that they have to be the ones that manage that risk effectively. And I think that what we've had is a lot of people organising these events have also been reckless. So I think that it's going to be individual behaviour, but it's also going to be control of those contexts where these super spreading events are very probable. So I think that we have to get a lot more targeted. But I think it is going to be very difficult for us to target anything that would shut down general business, because I think that a lot of people are still working from home. A lot of businesses are still very cautious and better protected. But what they can't do is protect people when they go into social settings that are outside the business world. So I don't think we need to ever go back into generalized lockdowns, but we do need to look at where the source of the problem is.
Absolutely.
And get better at controlling.
Thank you so much for your time this evening. That was Professor Alex Van Den Heever, a specialist in health economics and finance at the Wits School of Governance.